question is the difference between normal brain aging and mild cognitive impairment, and it's a very difficult question to answer, really. For some 50 years now, perhaps some more, we have been trying to disentangle what's normal aging and what's disease, and what's the blurred part in between. Many years ago, when I started, most things were senile, the heart, cataract, or whatever. And now we know that normal aging is much less than we expect if aging is successful. So normal cognitive aging only has minor changes in cognition. For instance, increasing time to remember things. You need more time to gather your memories compared with younger people, but then your memories will be okay. So this is very little. In fact, mild cognitive impairment is defined by being quite below normality for your age. So the difference probably is only statistical, the same as happens in hypertension. There's a number below which you consider to have mild cognitive impairment. But this is still an evolving field. Mild cognitive impairment is now included in the international classification of diseases, as it has a code there. So you can consider that a disease. Again, defining diseases nowadays is not so easy because there are very many different criteria, from those purely biological to those based on statistics as psychiatric diagnosis. But at this time, it is a condition that you can code, you can use in your files, and you can use to detect patients that are very high risk of dementia. And this is important because in very few years, we expect to have some drugs that modify the cause of MCI and reduce the risk of dementia. And also interventions on your lifestyle, which are relevant for this symposium. The diagnosis of MCI means that something will happen to you in the future. At least 1/3, even if the studies are not exactly coincident, will have some kind of dementia, mostly Alzheimer's disease, but for other kinds that are not amnestic MCI, you may have risk to have vascular dementia or other kinds of dementia. At least 1/3, which is not good. Some other people who stay for long with MCI, and how long, we don't know. Perhaps on the long term, you'll have a dementia. And some of them will never have dementia and only have these minor derangements in the memory or other cognitive areas. So it's not a good diagnosis, but it's not the worst diagnosis you can have, because you have the chance to stay that way for the rest of your life. When asked for treatments for a condition like this that's long-standing, it's interesting that the question starts with pharmacologic. You have to start with non-pharmacological therapies, with things that you can do for a whole population, and counseling about health styles. The only non-pharmacological intervention that has shown some effect is physical exercise. And this is in the short term, 6 months. We don't know for longer, and we don't know about increasing physical activity in long-term trials. For nutrition, we have small trials, but we still lack major trials showing that nutrition intervention, even by dietary changes or nutritional supplements, do change the natural course of MCI. And all the drugs that have been tested have been disappointing. At this time, no drug can be recommended to treat mild cognitive impairment with sound science or sound evidence behind.